Hello, everyone. Welcome to the Innovations in Healthcare panel. My name is Susan Lee MacDonald, and I will be moderating the panel today. I would like to introduce myself first. I am a TV talk show host at Arirang TV. I host a TV talk show called The Interview. It's a one-hour TV show where I interview very important and fun celebrities. And it is my honor to be able to be a part of this panel to ask great questions of innovations in healthcare for our distinguished guests. And I'd like for our guests to introduce themselves for about 2 minutes each.
All right, hello everybody. My name is Huang. I'm the founder of RedOctane. My brother and I founded the company. My background is in games. We make video games. Guitar Hero is the game that we were most well known for. It was one of the biggest video games in North America and in Europe, went on to generate about $4 billion in sales in about 3 years. And now, our company was acquired by Activision. I was at Activision for 4 years, and now I'm starting a new company in health. Have always had an interest in it, have always wanted to figure out how can we bring the engagement of games, because games are very engaging, make you want to come back, they're very addicting. And how do we take that and apply it to health in another industry where there's a huge need? And how do we take those mechanics and the different things that we can do to make great games, but apply it in a new area?
Thank you. Next.
Hello, I'm Catherine Mohr, and I am the Senior Director of Medical Research at Intuitive Surgical, the company that makes the Da Vinci surgical robot. And I've been working the last few years in the medical device industry, looking at different ways in which we can take new technology and bring it onto a robotic platform to aid in clinical decision making and improving the way in which we can achieve better patient outcomes. And so I'm very excited to be talking about ways in which we can be training and ways in which we can do data and the device industry in and of itself.
Thank you. Next.
Hello, everyone. My name is Pavan Nigam. First, I just want to thank Spark Labs for hosting this place at the Gangnam district. I told my daughter, my teenage daughter yesterday, she was so thrilled. She said, "Dad, make sure you come back with a picture of a Sai." So if anybody can help me with that, that's great. So currently I live in Silicon Valley, and I run an angel investment group called Inspiration. Which does seed and Series A investing in a variety of different areas. My background, I started off doing very techy, nerdy stuff, compilers and 3D graphics. But in '96, got into healthcare, and in a funny way, my friend Jim Clark has started a company called Netscape, which went public, and the whole internet thing, it was like the Wild West suddenly. And eBay and Yahoo and everything was coming along, and Jim and I got together and we said, okay, which area is healthcare is the internet going to have the biggest impact on? And in our own judgment, we figured it's healthcare. And that's how we started the parent company of WebMD called Healtheon. And like most people, we got into healthcare because the numbers are dramatic. You just tell people it was 13% of the GNP, which is, we used to try to scare people with that number. Now it's 18%, so it's like 2.5 trillion. That's a big number to make anything very attractive. And so we got into it, and many things we did phenomenally well, one of them being WebMD itself, which is the most popular website since then, and some things which didn't work out. But I do think that now is the perfect time to do healthcare startups, because it's a perfect storm coming, and I'm sure in the discussion we're going to get to it, but we can thank the smartphone for that, which is enabling that. So thank you, iPhone, and thank you, Samsung, for making the whole world a lot more tech literate now.
Thank you all. It's important to be aware of the fact that this is somewhat of a mixed audience. We do have Koreans, we have Americans, and we have so many people from different countries. And healthcare is different in each country. Healthcare regulations and technology, though, is global. What I'd like to be able to ask our panelists is to talk about why there's a sudden surge of excitement in investing in healthcare technology. and if you wouldn't mind commenting on your particular sectors as well.
There's definitely a lot of activity, and people like me who are new to the industry and trying to figure out what's happening. And for me, it's just a great time. I think the technology has moved to a point where really too fast, where it's jumping. The technology is jumping ahead of people being able to think about how we use it. And I think health is one of those categories which has historically been a big problem, and it's continuing to grow. This is the first time in the history of the world where there are more people that are overweight than people that are starving. And trying to figure out how you can solve those types of problems on a mass scale is really interesting. I love creating games, and it's fun to create a popular game and see people enjoy it. But for me, on a personal level, if I can develop a product and have someone get healthy in the process, that to me is really interesting, and that's part of the reason for me I'm getting into the space. And I think for a lot of entrepreneurs, it's trying to figure out how they can make an impact on the world, not with just the product that they're building, but also trying to get people healthier.
In the device world, where I spend most of my time, a lot of the new innovation is coming out of just the dizzying amount of innovation that's coming out of research laboratories and universities around the world. We're seeing new types of lasers, we're seeing new ways of cutting or joining tissue, many new sorts of fluorescence molecules that allow us to tag a cancer or tag nerves and be able to see where those are in the body. And this dizzying amount of new technology that's coming out in a very raw form is just begging in many ways to be turned into small companies that can exploit ways in which these new technologies can help improve patient outcomes. Where it affects me, and one of the things that I'm most interested and excited about in this area, is that we have platform technologies like surgical robotics or like a lot of the imaging systems that are out there that are capable of having many of these little technologies added onto them in order to improve the outcomes. And so we're seeing, in terms of the larger platform technologies, ready-made customers for a lot of these smaller companies that are doing innovative new development. And recently there's been a little bit of a resurgence in money being put into some of these early phase medical devices after a bit of a dry spell. And so I'm very excited about some of the new companies I'm seeing come up.
Fantastic, thanks.
Yeah, I echo with what Kai said. When you do healthcare, it is something which, while you are trying to do a company and make money, there is some element of give back to it. So, in my resume, that's the only company my mother understands. So that certainly helps. At least there's something she gets on that front. I do think that I alluded earlier to this perfect storm, and a bunch of things actually are happening now which makes certain things possible which otherwise were not, just even as recently as 5 years ago. And that's why you see this big uptick in investment happening in healthcare. A bunch of them. One, on the technology front, smartphones. Big deal. It's a huge deal. When we tried doing something in the WebMD time, trying to connect patients and doctors didn't like technology. They said, we tried to give them free Palm Pilots. I don't know how many people even remember there used to be something called Palm. So we tried to give these mobile devices to them, and they did not take it because they don't like technology. Well, guess what? Everyone now is using a smartphone. All doctors, they go home, they do iPadding, they do whatever. So at least we can assume a certain baseline level of technology. So just that, having the smartphone around as a mobile device, which is available to people, whether they are patients or doctors, moving around, access to stuff is key. The second thing on technology is this whole notion the cloud services have caught on, and indirectly what's that's making possible is access to real-time data anytime, anywhere. So you pretty much have all the data anytime, anywhere you want it. And that means you can quickly assemble the data. You can, which takes me to the next technology thing, which is data mining. You can mine the data. You can actually go and make recommendations. And you can do pretty much all of this stuff in real time. So I think just technically, so many things are possible which were just not possible before. I think behaviorally as a society, I think they've changed also compared to just a few years ago. As consumers, we are used to getting to having all our information available to us all the time, whether it's on the financial side, whether it's on the personal side. One exception to that is healthcare. And people are saying, how come for every other element of our lives, I have access to every detail about it. And in healthcare, when it comes, I don't even know what my last lab results were. So that's a big thing which is happening. Socially, people are demanding that I need to have that information. I think the other thing which is happening on the behavioral side is how freely people are sharing stuff. And that also, with the advent of social networks, again, people are becoming more used to that. And that helps because I've seen a surge in terms of collaboration startups, where people are collaborating, people who might have similar conditions, who feel very comfortable now sharing information, what's working for them, what's not working for them, asking for ideas. So I think that's on the behavioral side. And then, at least for the United States itself, on the regulatory side, some very key elements are happening where the government is using a carrot and stick approach to force technologies to happen. And healthcare has a history of moving very, very slowly. And sometimes you need somebody as large and powerful as the government to make things happen. And it's showing results. I mean, a couple of simple examples is that the government has imposed that by a certain time, all doctors have to have an electronic medical record system. And if they do it and use it, they actually get $50,000 for that. So that's a carrot. If they don't, then there's a penalty element. So the adoption of electronic healthcare systems has quadrupled in the last 3-4 years. Similarly, if people are going to hospitals and they get readmitted within 30 days, very often it happens for a variety of reasons, things were not done properly and people go back to the hospital. If that happens, the government is penalizing the hospitals for that. So that means that now the hospitals have to make sure that they do all the right things to minimize people coming back. And that is just opening up so many opportunities for startups to kind of streamline that process too. So just a combination of technology and behavioral and the regulatory stuff is just creating that perfect storm for, this is a great time to be doing healthcare startups.
I'd like to ask Pavan this. You helped to create WebMD, and that basically helped to democratize medical information for so many people. And before that, there were no resources for people to get very detailed information about their particular symptoms or diseases and whatnot. And now, after 10, 15 years, patients have become very sophisticated, and it's not just an informal community of people trying to find out about them, their diseases and issues. What do you think has changed from that time till now about how patients desire and want their information?
I remember a time I had gone to a doctor, I think maybe 10 years ago I'm forgetting even what the deal was, but I went to WebMD and researched it. I think it was like an inner ear infection, something minor. But I kind of researched it and went to my doctor in Palo Alto. So again, in a very high-tech area. He did not like it. He did not like the fact that the patient is coming armed with information and asking him questions. Because doctors are used to be this figure that I look at you, I ask you questions, and I tell you what to do. And they did not like the fact that the patient came armed with information. I think now they're getting used to it because pretty much that's what everyone does. I think most people, when they end up going to physicians, they end up researching stuff beforehand. And that's great because, one, they can research their condition, but even more so, they can actually look at at other people who've gone through similar experiences to see what worked for them, what didn't work for them. So I think at the end of the day, it's a great thing, and that's why the website is so popular, and it takes a lot of effort to keep that website going. We have an army of people. I mean, I'm no longer with the company, but there's an army of people who are constantly going in and being the editorial board on all the content that gets in. So the content quality is so good, and that's why it just is the first place people end up going for healthcare information.
I'd like to ask Catherine this question. We talked about the perfect storm, about how this is a really great time for people to invest. And you've been involved in surgical devices and robotics in particular. I think that people tend to have a real fantasy about what robots can do. And there's also sometimes some fear about, can robots possibly take over what people will do? Will robots be the only things that operate on me? And that creates a sense of kind of insecurity and a little bit of fear. Would you be able to comment on what's actually happening in the robotics field right now?
Sure. There are actually quite a few different kinds of surgical robots that are out in general use now. Our system is a telemanipulator. And what that means is that the surgeon is sitting at a console and making a motion with their hands. And there are very, very small instruments that are inside the body, placed in there through very small incisions, that follow every motion of what the surgeon's hands are doing. And so there's no autonomous decision-making on the part of the robot. It's not deciding what to cut. It is purely an extension or an augmentation of that surgeon. The surgeon's doing the surgery through this telemanipulator. There are a few other types of robots out there, Corexo in particular, a Korean company that makes a surgical robot that does hip implants. And in those cases, the surgeon is pre-planning what's going to happen, and then the robot executes what the surgeon has planned into the robot. But in neither of those cases is the robot actually making any of the decisions. There's still clinical judgment involved, and I really tend to think of these medical robots as really more of an extension of the capabilities of the surgeon rather than a replacement for the surgeon. Now, perhaps Kai or Pavan can comment too. There are a lot of new programs that are coming out that are looking at trying to do intelligent decision-making, helping people diagnose and improve that sort of decision-making. But I don't think we're going to see that in execution of surgical tasks anytime soon.
With the type of training that would be necessary to train the doctors on how to use robotics or these particular devices, it seems that with gaming, there are so many areas where gaming has helped pilots and so many other professionals in various sectors of industry. And I'm curious if Kai or any of you have some comments as to how to train medical professionals with using gaming.
Well, I have no idea how to train a medical professional. I should never be doing that. No one should ever allow me to do that. But you know, games is one of those categories that you can apply to a lot of different things, and training is a perfect example. Games are about goals and getting you towards your goals, and that's what training is. There's an ultimate objective and there's an ultimate goal. The question is, how do you design a system or a structure such that getting to that goal is interesting or fun or engaging over the long term? And that's what we try to apply. So, you know, there's various techniques and tactics and things around trying to develop a really good system, a real feedback loop. I think one of the core things that we always look at in making great games is the feedback loop. How do you create a really engaging feedback loop? And sometimes, you know, we'll break it down to, we look at it in terms of second to second, minute to minute, day to day, and month to month. And you want to make sure that you're hitting all of those different areas. So second to second, I do something, I get a reaction. I do this, something happens. I get rewarded or I get punished. Those are the second to second feedback loops that are really important to look at, that make games what they are, great games. Then you have to look at the minute to minute. Okay, those were the seconds, and you're collecting things, and sounds are happening, and I'm moving forward. But how do you reward people on a minute-to-minute basis? And do we have those feedback loops built in? And then you move on to, day to day, right? How do you create a long-term product that really engages people over the long term? And you have to think about, what kind of mechanics do I do that get people to want to come back on a day-to-day basis? I've hooked you in every second to second. I've hooked you in from minute to minute, but how do I hook you in from day to day? And then ultimately, where I think the best products stand out are, how do you then bring people back on a month-to-month basis and create real long-term engaging value? And I think those principles can be taken and applied to training and education in the health category.
Yeah, just to add a comment on that, one of the things that we have seen happening with a lot of new technologies coming out into healthcare is that in our old model of training surgeons or training healthcare professionals of any sort, we go through medical school and then through residency, and then we turn them loose and we say, now practice medicine the way you just learned it in medical school and residency. But the truth is that new technologies are coming in all the time, and our medical training systems are not prepared to deal with a surgeon who's been out or a physician who's been out for 10 years and now has to learn something new. And so we do make simulators for a lot of these new technologies that we bring out, but to Kai's point, unless they're very engaging, unless there's something that people with a very busy clinical schedule are going to do this, not because they feel they ought to, but because there's additional intrinsic rewards associated with doing it. They actually have some fun learning these new skills, that we will not be able to bring these new technologies out as successfully. And so hand in glove with us doing new technological advancements in medicine are going to be new technological advancements in the way that we train and the way we engage people in continuous learning.
Yeah, I think the target audience for the game system is still going to be the consumers. It's stretching it to think that doctors are going to be playing games, but you have to look at it. So there's a lot of games already on App Store and so on. Most of them directed towards fitness. I think you'll see more this reward system come. I don't want to call it a game. The whole reward incentive system come in play, where other people who are incentivized in seeing you healthy do it. I mean, it could be your employer who wants a healthy workforce, who is providing some system of rewards over there. It could be a doctor who, again, suggests your treatment, and he wants you to conform to that. And interestingly, I recently saw a startup which is working on a gamified system for drug companies. I mean, not many people might know, but drug companies every year spend close to $1 billion on just making sure people comply to the prescriptions. Because guess what? If you forget to take the pills or you don't order refills, who's losing money? It's a drug company who's losing money on that. So there's a nice system. I mean, this person had a very nice application, which was a system for reminding them and incentivizing them and recognizing them and making them a 5-star patient or whatever for doing it. So I do think that technology is going to somehow be there to make a purpose happen, whether it is complying with pills and so on.
It seems that it would be really a challenge to think about how to monetize games, though. And I'm curious, what are some recent trends, or what are some ways to help monetize that?
And the question is around monetizing games and the product?
Yes.
There's been a huge shift in the last 5 years, technology disruption. We've seen a huge transition. Traditionally, games have been PC and console-based, PC and Microsoft Xbox and Sony PlayStation, Nintendo. And the rise of the mobile platform and tablet has really disrupted the market and fundamentally changing the way people monetize games. So traditionally, it's you pay up front and there's a high entry cost, high barrier. And now everything's going to free to play, which is, there is no entry barrier, but now it's a totally different way to monetize, right? Now you have to extract money from people slowly over time. which I think is a good thing. I think that it's a different era and it's a different category, but I think what it really forces developers and creators and entrepreneurs to think about is, how do I monetize over time? And how do I get people to spend money? And ultimately what that forces you to do is to create a great product.
And I agree with that. I do think that there are other interested parties in your health. And like the example, like you can't make employers or drug companies pay for it. I mean, this example I was saying that there's drug companies who are paying them money for having a nice system to ensure compliance. So it all depends on the nature of the game. But there are other people besides the target person who care about the health, who actually will pay for that.
That's right. And that was one of the most interesting areas for me, moving from the game category into health and really just understanding the category. We spent a couple of years just exploring and trying to figure out where are the opportunities. Employee or employer-funded health programs, right, becoming much more popular. And all of a sudden, now there's an incentive for your employer to actually keep you healthy because they're paying for all the costs themselves. And they never really had to think about that. It was all, insurance company. Now employers, more progressive ones, are self-insuring and trying to figure out, okay, it's not just about treating you when you're sick, it's trying to figure out how can I keep you healthy? And ultimately, over the long term, that's a reduction in cost. And so that's where the incentive programs, that's where, how do you take the example of games and you can apply it? Now, there's an incentive for them to keep you healthy, so they have to figure out what systems do I put in place so that you want to get healthier, so I can keep you as an employee healthy.
What are some of the challenges of keeping people engaged long term in these games, though? You mentioned a little bit about the feedback loops and all the data that you're acquiring and learning behaviors of the consumers who would use the games. What would keep them, I guess that's a key question, right? What would keep them coming back for more and more?
I think, a big part of it that we spend a lot of time looking at is the social aspect of it. That's one of the things that I think great games do, is that they bring people together. There's a lot of games that, it's just me and it's my time and I play by myself. But what we try to look at is, how do you take activities and behaviors that people are already doing and then enhance that? So in the health space, one of the activities that we clearly see is people, when they want to get healthier, particularly when it comes to losing weight, the specific area of losing weight, they usually want to do it together with someone else. They want motivation. Or when people are exercising, usually, you get a workout buddy and someone to help push you along and carry you along those goals. So I think one of the long-term behaviors is that there has to be some social aspect to it. World of Warcraft is, we were talking earlier, one of the most popular games. And I look at it as basically one giant social network. It's a social network with a game wrapped around it. People go and they play World of Warcraft because they're hanging out with their friends and they're having fun. And then there's, a pretty cool game loosely tied to that. And so for us, that's a basic, simple mechanic that we think about. Okay, people are doing these things. The social aspect of it is what draws people in. How do we apply that to what we're doing in health and enhance that behavior? And so I think the social nature for me is a big area that we look at.
In some of the areas that I'm looking at in terms of training, it's a very different kind of set of challenges associated with it. We're looking at continuous medical education and a workforce that's out there and trying to keep up to date with new technologies, at the same time having an incredibly difficult workload in terms of their clinical workload, competing for their time. And so generally it's a little bit optimistic to think that these games are going to be intrinsically fun, that they're going to be as fun as doing World of Warcraft or some of the other sorts of things. But we can learn so much from the long-term engagement lessons that we can learn from these sorts of games to be able to make this continuous learning in healthcare and also in other areas where people are trying to acquire new skills and learn techniques for keeping people continually engaged. And to the point that there's other people who would be willing to pay for this, that you don't need to make the players of the game be the ones that are funding it. There are medical schools, universities, device manufacturers, drug companies, all who are invested in you having these skills or knowledge and may be willing to do the bankroll on a particular game. And if you're an entrepreneur wanting to develop in these spaces, sometimes having a known single customer that you can go to in order to be the pay or the funder of the game is going to be easier than figuring out how to monetize it from lots and lots of consumers.
I mean, games are hard to engage for the long haul. I mean, anyone who's been playing Zynga games and so on, at some point in time, they kind of wear off on you and you move on. So it is a hard problem to kind of crack. Having said that, I think social is one key element to it because people want to play or do stuff with other people. And the second thing is when it comes to healthcare, it has to evolve with you. I mean, your needs, your everything is changing, and so the game has to change along with it. And it's going to be an experiment, so no idea what's going to work. But certainly that is unique about healthcare is that, over time, your healthcare needs and everything change.
Pavan, you've been an investor, an angel investor for a number of years, and I'm curious, what are some of the new business trends in healthcare that you've been seeing? And maybe Kai, you can also kind of comment to this as well. Happen to.
It is remarkable that in the last 1 year or so, I mean, there's this upsurge in healthcare investing and healthcare ideas. And some of them are what I would kind of put into the revolutionary category. And some of them are more evolutionary, good stuff to do, but maybe perhaps might not be the most exciting thing. So let me just comment on both of them. I think on the revolutionary side, I mean, one thing I see is, what used to be called telemedicine in the olden days is this whole idea about making the patient-doctor interaction, streamline that. And even more than streamlining, reduce that. So I've seen companies where now with the smartphone, which has got such a great camera, if I have any skin problem, for instance, or if I have like a red eye, there's really no need for me in most cases to end up going to the doctor's office, get an appointment, wait for 2 hours where the doctor looks at that probably routine thing for that person, and in 5 minutes giving me an answer and coming back. Now what one can do is I can go to a smartphone application. I can pick my doctor there, who will guarantee me feedback within the hour. I can the application will ask me some questions and then tell me to take a picture. It'll help me take the right picture, whether it's my skin for the dermatologist or whether it's my eye for the ophthalmologist, and send it. And I think from the doctor's point of view, the doctor is basically going from one office visit to another. And in between that, they can squeeze in, they have all the information they need. They can take a look at the information, and in 2 minutes, just respond back to it. And just for that, they made, let's say, $50. That's way more efficient in terms of dollar per minute they're going to be making than having the patient come and they spend all the time in the niceties and the nurse going and getting the person ready and so on. So that's just an example. I mean, there are other things where you don't need a doctor. Maybe a nursing professional is good enough. So again, there are many websites. So there's a big set of companies, startups, which are trying to go and just deal with the patient-doctor communication. So, and again, that is possible because we have the smart app, the smartphone over here. It's got a great camera. I can connect sensors to it it can take my pulse, it can take my blood pressure, it can do all kinds of stuff. So there's a big set of companies in that direction. The other one is having this old notion of personal healthcare record. This whole idea that it's my health, I should have all my information in one place, whether it's the visits to the doctors, all my lab results, all the recommendations the doctors made over the years, my MRIs, my DNA stuff from 23andMe, whatever's coming from it. I have things at home, which is my scale and my blood pressure equipment, which is Bluetooth enabled. Everything in one place, and is being mined for stuff. It's going and making recommendations to me based on all the information it's getting about things to do. So those are big category things where there are numerous startups coming up. And then you have the more traditional stuff about if a patient is leaving the hospital, if everyone has an iPad, can they streamline it instead of them taking 24 hours to coordinate between all the doctors and nurses about what my care should be once I go home? They can do it much faster, much more streamlined, and coordinate once I go home. They can still coordinate along with it, monitoring am I complying with that or not. So there are ideas like that. There are companies which are mining gazillions. I mean, this is like huge amounts of data which is available to make consumers smarter by knowing that, you can get a colonoscopy done in a hospital in San Francisco for $2,000, and then the same thing done in some other place for $5,000. Now, is it better? Is the doctor who's doing it, is the track record better? So there's all this information available which can be mined and made available to you. So again, there's a flurry of companies doing that. And then there are people just doing collaboration, which is, again, enough people who have reason to communicate with each other, whether it's their own diseases, whether they are taking care of the kids, the parents. And so again, there's a lot of collaboration websites which are coming along. So this just a huge spectrum of ideas floating around just now.
I mean, indeed, a lot of the things that you've talked about initially about the possibility to take a photo of my arm or some part of my body that is infected and just send it and get an answer within an hour. It seems like something so far into the future, but the technology is right here, right now, and I'm just curious, how soon can we actually see this happening? I mean, are doctors really willing to take this approach because they see that it's much more effective and they will be able to have more patients and take care of more people?
It's happening now. I mean, there are all these early tests, right? These are very well-funded companies who are doing it. So the answer is happening now, and the one barrier that used to be there was, are insurance companies going to pay for it or not? That used to be one barrier. And the second one used to be the liability, which is if I'm doing something not in person, is what's the liability involved? And again, the regulations and the new healthcare stuff are kind of minimizing that. And companies are paying for it. It's amazing how many, Kaiser, which is a healthcare plan there, it's amazing how many e-visits which are being conducted over there now. So this is all reality, and I think it's just now it's stuff which is visually can be done, things like skin care and eye. But with the proliferation of sensors for other kinds of vital information which can be aggregated, I wouldn't be surprised if it's going to just expand to more and more and more disciplines.
Yeah, I think just to add to that point, Pavan, that there's clearly, as you said, no shortage of opportunities, right? I mean, in the healthcare space, there's a tremendous amount of opportunity, and the technology is far ahead of what we can think. Sensors really being, I think, the one area that's been particularly of interest to me, but I think is a huge category, right? I think you were talking about it earlier, Pavan, where we spend an incredible amount of time and effort tracking the world around us, but almost none tracking ourselves, right? There's very, very little data. Pretty much the only data that's on record for your health is maybe every few years you go to a doctor, and the doctor takes a few notes and asks you, how are you feeling? Oh, it kind of hurts today. Have you been eating well? Are you exercising? Do you smoke? You get the same questions, right? And that happens maybe every 3, 4, 5 years. So it's very, very little data. Imagine what could happen if somebody, a professional, a medical professional, your doctor, had data to fill in those gaps. What happens the last time that you visit a doctor was 5 years ago, but what happened in between? Nobody knows. But if we could track that, and with the proliferation of the sensors and technology, I think that's a huge, huge opportunity. And there are companies already that are starting, like Fitbit and Jawbone and Nike, and Basis, that are starting to try to track us on a daily basis. But really, I think we'll probably look back on this in 10 years and say, wow, that's so barbaric. All we could do is track how many steps I took versus really your vital signs. on a daily basis. That's much more interesting. And the holy grail to me is really around one of the holy grails is a lot of areas, but I think in the area of tracking and data, I think where we spent a lot of time looking at is trying to get three pieces of data. First, your biometric data, and that's all the trackers and your life signs, and I think we're really just at the beginning of that revolution. The smartphones and technology and sensors are making that possible, but we'll look back on this and say, how incredibly, crude we were. So first piece is getting your biometric data. The second piece is getting your environmental data, all right? So I live here in Seoul, and this is what the weather is like, and this is what the air quality is like, and this is what the water quality is like, all of those things. A lot of that data is actually pretty available today. And so you combine that data. And then the third piece is genetic. All right, so there are companies like 23andMe that are already helping people understand genetically, how was I born? What is the genetic makeup of what I look like? And I think the holy grail to me is when the company that can start to combine all of those. I think it starts with sensors and biometrics, but if I can take your biometric data and understand your genetics and understand where you live and triangulate all of that data, then it becomes hugely powerful. And I think that the beginning of that really will be the sensors and starting with the sensors, but eventually pulling all of that data in.
Well, and I would agree with both of you on these are enormous and very important trends in terms of wellness and moving our healthcare away from the acute care situation into maintenance of health prior to getting into an acute care situation. But the elephant that sits in the living room of all of our healthcare systems is that we spend an enormous amount of money on acute incidents and on surgery and on chronic management of chronic disease and things like this. And a lot of what we need, when you asked about trends, one of the biggest trends that's happening in healthcare systems all over the planet we're looking at where we are spending all of this money and how can we bring in new technologies that are going to displace some of those costs? How are we going to get better outcomes for the same or less cost? And every new technology that's going to come in and try to fight for its place in the healthcare armamentarium that we have in acute care is going to have to be displacing costs or at least being at the same cost. And that's an enormous trend that we're seeing in terms of demands that are being made on any new technology that's being introduced.
It seems like, from my understanding of the past year, there's been over $1 billion of money infusion from VCs into healthcare technology, and that's 10 times more than the previous year. That's quite a lot of money going in 1 year. And I'm curious, do you think that this could be just truly the next wave? Is this a bubble? It seems like there is a lot of opportunity for entrepreneurship, but I would like your opinion on this.
No, I personally, I don't think it's a bubble. There's, again, healthcare has this unique aspect where it's a huge market, the numbers are big, you have people who care about it. So these VCs, guess what? They do care about it because they have their own health. They can relate to the problem. So that certainly helps. And technologies have just got to that point. I mean, I keep emphasizing the smartphone. The smartphone, probably the best thing that's happened in healthcare. It's made everybody very literate. It's a hub. I mean, we just talked about you can collect sensors, you can collect all kinds of information in one place. So I think that lots of smart people are realizing this, entrepreneurs and VCs, and that's why the investments are only going to keep going up.
Yeah, and the synergies between these different technologies are only improving as well. We see new diagnostic technologies coming out so that diseases can be diagnosed earlier, and that lets us intervene earlier in a way that lets the patient just get on with their life, as opposed to having to find things late and do a big salvage surgery. And so I see this information and monitoring and all of these feeding into us heading off acute disease earlier and earlier in the chain. And so rather than in isolation, I think there's an enormous synergy between these new technologies that are coming up.
Yeah, I agree with what both of you said, and I definitely don't think it's a bubble. At least in the sense of there are going to be companies that succeed, and of course some companies that won't succeed. But I do think that this area of health, even from my short time in the space, there's just so much opportunity, and there's so much that can be done. And certain companies and certain products and certain services will work, and some won't. But that's the fun part of exploring right now with all these different startups and what they're trying is what is going to work. But it's clear to me that we're really at the beginning of that cycle, that there is so much still left to be done, whether it's in data monitoring or tracking or medical devices or looking at certain niche populations, the old, the young. There's a lot of big problems to be tackled. And so I think it's really just the beginning of that.
Our time is almost up, and I'd like to ask you if you have any parting thoughts before we leave regarding innovations in healthcare to share with our audience.
I think we've emphasized enough. This is a great time. It reminds me of when the whole Healtheon WebMD thing were happening, where the internet came along, and as I mentioned, there was a Wild West, and lots of companies came out of it. And I do think it's very similar. There's just some really exciting technologies which are just maturing. I mean, there's obviously the smartphone and data mining and real-time collaboration. So this is a great, so if anybody is interested in that, you couldn't find a better time to go and do a company.
And I would just add and emphasize that when you're thinking about launching a new company or in developing a new technology, this area has a fairly simple litmus test to it. If you step back and you say, how will what I am doing affect the outcomes for the patients or the people? Let's not call them patients, let's call ourselves people. How will this affect people's quality of life? Will it change outcomes? Will it make them healthier longer? And if the answer to that is yes, then it becomes a much, much simpler decision-making process. This is an important one to subject any idea to. How will it help the person that's using it? And then after that, it's just selling the idea to a VC.
Yeah, you ask a very simple question, right? Do I want to be healthy? And do I want to live longer? And I think everybody would say yes. But I think we'll look back and say, well, there's really nothing that we're doing today that's helping that. And so it's a great time to kind of be a part of that exploration process.
I'd like to thank Kai Huang, Dr. Catherine Mohr, Pavan Nigam, and everyone here who has attended for this amazing conference here. And if you have any questions, I'm sure that you might be able to find each of our panelists later on. Thank you again for being a part of Innovations in Healthcare today. Thank you.